You may not realize it, but that annual health checkup you undergo every year could actually be harming your health. This is a shocking truth that major university hospitals rarely admit. My name is Dr. Jun-Young Baek. I've dedicated over 60 years to the practice of internal medicine, once serving as chief of internal medicine at a leading university hospital. Now, at 90 years old, I have treated tens of thousands of patients throughout my life. Today, I will share with you the distilled wisdom I've gathered over 6 decades in the medical field. Just 5 minutes of your time could save you hundreds, perhaps thousands of dollars. And more importantly, help you understand which tests are truly essential for your health. Have you ever wondered if those routine tests you consider mandatory every year might actually be making you sicker? Could those expensive full-body exams be serving hospital revenues more than your well-being? Are your anxieties being exploited, leading to unnecessary tests and medications? This is the uncomfortable truth of modern medicine. Excessive treatments and redundant tests that often end up harming healthy individuals. Does that sound exaggerated? Allow me to share a real case from my own experience. Mrs. Kim, 67 years old, was someone who diligently underwent full-body checkups every year. One day, an MRI scan detected minor white matter changes in her brain, something commonly seen with aging. But upon hearing the results, Mrs. Kim became consumed with fear, terrified of stroke or dementia. The anxiety and depression that followed rapidly deteriorated her health. She was prescribed unnecessary medications, and in the end, it wasn't any disease, but rather the fear induced by the test results that damaged her well-being. And what about me? At 90 years old, I undergo only the most essential screenings. I avoid unnecessary tests that might only serve to worry me. Instead, I focus on receiving carefully selected regular exams that are truly necessary. The result? I've managed to enjoy a vibrant, healthy old age, free from major illness. Today, I will reveal the 3 routine tests that, after the age of 60, could actually do more harm than good, and the 2 critical tests you must never skip. Pay close attention, for the first unnecessary test is one aggressively promoted by large hospitals. I'll explain why it's unnecessary for most seniors and in which cases it might still be beneficial. Stay with me until the end. The truth about unnecessary medical exams could save your peace of mind, your wallet, and possibly your life. Medicine is miraculous, but no test benefits everyone equally. My advice stems from 6 decades of first-hand experience. Listen closely and make wise decisions for your health. If you find this information helpful, please consider subscribing and giving a thumbs up. It's entirely free, and just one click allows you to keep receiving valuable health insights. And if you know someone who might benefit, share this with them, a small gesture that could grant someone a healthier, happier old age. Now let us begin. Before we dive into the unnecessary tests, let me first tell you about the truly essential ones. The first is the colonoscopy. Colonoscopy allows us to directly examine the colon and rectum for polyps, cancers, or inflammatory diseases. The colon lies deep within the body, often hiding its warning signs until diseases have progressed significantly. Therefore, early detection before any symptoms appear is crucial. Doctor, I have no symptoms. Why should I get tested? I hear this question often. And yet, this is the very point. By the time symptoms arise, the cancer may already be advanced. In Korea, colorectal cancer is one of the most common cancers among the elderly. According to the National Cancer Center, as of 2020, colorectal cancer ranks among the top in cancer incidence for both men and women. Fortunately, when detected early, the cure rate exceeds 90%. Typically, it takes 5 to 10 years for a polyp to develop into cancer. This gives us a precious window of time. Regular colonoscopies allow us to find and remove these polyps before they turn into cancer. That's how a colonoscopy can save lives. Take Mr. Park, one of my longtime patients. At 71, he had his first colonoscopy, despite feeling perfectly healthy. A polyp measuring 1.5 centimeters was discovered. Biopsy revealed early cancerous changes. The polyp was removed immediately, and no further treatment was needed. "Doctor, you saved my life. I kept delaying the exam since I felt fine." Since then, Mr. Park has been receiving regular colonoscopies every 3 years. I myself began regular colonoscopies at the age of 60. At 75, a small polyp was found and removed. Even as a doctor, I am not immune to these risks. Among my physician colleagues, I've seen several who delayed screening and ended up battling advanced colorectal cancer. Over my 60-year career, I've observed that patients who receive regular colonoscopies enjoy far healthier senior years than those who don't. So, how often should you get tested? According to the Korean Society of Gastrointestinal Endoscopy, screening should start at age 50. If no abnormalities are found, repeat every 5 years. If polyps are discovered, follow-up intervals depend on their size and number, typically 1 to 3 years. Even beyond age 75, continued screening is recommended for those in good overall health. After 80, decisions should be made through consultation with your physician based on health status and life expectancy. Personally, at age 90, I've chosen not to undergo further colonoscopies. Every medical test must balance benefit and risk. According to data from the National Cancer Center, colonoscopies reduce colorectal cancer mortality by 60% to 70%. The 5-year survival rate for early-stage colorectal cancer exceeds 90%, but for late-stage cancer, it drops to around 14%. In Korea, national cancer screening programs offer fecal occult blood tests every 1 to 2 years for those over 50. If positive, a colonoscopy is provided. The complication rate for colonoscopy is very low. The benefits far outweigh the risks, a consensus held across the medical community. Following the colonoscopy, the second test I strongly recommend is especially important for Koreans. I've seen countless lives saved in my clinic thanks to this one. It is the upper endoscopy. Upper endoscopy allows us to visually examine the esophagus, stomach, and duodenum. Through this exam, we can detect gastritis, ulcers, esophagitis, and most importantly, stomach cancer. Korea has one of the highest rates of gastric cancer worldwide. Unlike Western populations, Koreans are more prone to precursor lesions that can lead to gastric cancer. The rate of Helicobacter pylori infection is also particularly high. "Doctor, I'm still young. Do I really need this?" Many patients have asked me. But gastric cancer often progresses silently, showing no symptoms in its early stages. By the time you experience discomfort or indigestion, the cancer may already be quite advanced. When detected early, the 5-year survival rate for gastric cancer exceeds 95%. However, for advanced stages, it drops sharply to below 30%. This is why regular upper endoscopies are so vital. Upper endoscopy doesn't just help prevent life-threatening cancer, it also improves quality of life by detecting common conditions like reflux esophagitis or chronic gastritis. Chronic cough or chest pain due to acid reflux can be accurately diagnosed and treated. Take Mrs. Kim, who underwent a national cancer screening endoscopy at 67. She had no symptoms and enjoyed good digestion. Yet, early-stage stomach cancer was discovered. A simple endoscopic resection cured her completely. 10 years later, she remains healthy. "Doctor, I kept putting off the exam for 3 years. I'm so thankful I finally came in." I remember vividly when I underwent my first upper endoscopy back in my 40s. At that time, sedation was not common, and the procedure was uncomfortable. But today, advancements allow most patients to undergo the procedure under sedation with little to no discomfort. Since my 60s, I've had endoscopies every 2 years. At age 70, I was diagnosed with atrophic gastritis and intestinal metaplasia, both precancerous conditions. As a result, I switched to annual screenings. My personal risk of developing gastric cancer had increased. In my 6 decades of practice, I've seen countless patients diagnosed with early-stage stomach cancer through regular endoscopies and fully cured with simple procedures. I strongly encourage my own family members to follow these preventive measures. In Korea's gastric cancer screening guidelines, it is recommended that individuals begin endoscopic screening at age 40, every 2 years. Those with a family history of gastric cancer should begin at 35. If precancerous lesions are found, annual screenings are advised. After age 80, decisions should be individualized based on personal health and physician consultation. Personally, I recommend that anyone over 60 opt for upper endoscopy rather than barium swallow tests. Endoscopy offers greater accuracy and allows for immediate biopsy if abnormalities are detected. According to the National Cancer Center, regular upper endoscopies reduce gastric cancer mortality by approximately 47%. A large study conducted in Korea showed that those who underwent endoscopy every 2 years had more than 50% lower risk of dying from stomach cancer compared to those who did not. The complication rate for upper endoscopy is very low. Serious complications from sedation occur in less than 0.01% of cases. Considering its affordability, around $10 under Korea's National Cancer Screening Program, it remains one of the most cost-effective preventive exams available. Compared to the cost of cancer treatment, this preventive measure is financially wise. To everyone who has followed along so far, my heartfelt congratulations. You've now learned the 2 essential screenings that can help protect your health after age 60. Now, allow me to share with you the next important secret, one that may save you from unnecessary expenses, anxiety, and needless treatments. Let's begin with the first of the unnecessary tests often recommended in comprehensive checkups, the echocardiogram. An echocardiogram uses ultrasound to assess the structure and function of the heart, evaluating valve disease, cardiac function, and the presence of blood clots. It is an extremely useful test when heart disease is suspected or when monitoring treatment progress. However, routine echocardiograms for healthy elderly individuals with no cardiac symptoms or risk factors are generally unnecessary. Just because it's offered as part of a comprehensive health check doesn't mean everyone needs it. There are several problems with unnecessary echocardiograms. First, the cost. Echocardiograms usually range from $150 to $300, creating a significant financial burden when done without medical necessity. Second, minor abnormalities may be discovered that have no clinical significance, leading to unnecessary additional tests and heightened anxiety. Normal age-related changes can often be mistaken for disease. Consider Mr. Young, who underwent a routine echocardiogram at 67 with no symptoms. The exam revealed mild aortic valve sclerosis. This led to considerable anxiety, additional testing, and multiple specialist consultations, only to conclude that it was simply an age-related change with no clinical significance. Doctor, I couldn't sleep after hearing the results. I was so afraid my heart was deteriorating, I even stopped exercising. In this case, unnecessary worry reduced his quality of life. At 80, I too was offered an echocardiogram during a comprehensive exam, but with no symptoms and a normal EKG, I declined. Instead, I focused on managing cardiovascular risk through regular exercise, blood pressure control, and a healthy diet, far more critical measures. One of my patients underwent yearly echocardiograms for years. Yet each year, the anxiety while awaiting results took a heavy toll, adding more stress than benefit. In medicine, unnecessary tests can diminish quality of life. When should an echocardiogram be considered? If you experience chest pain, shortness of breath, heart murmurs, or abnormal EKG findings. If there's a family history or known heart condition requiring follow-up. But for healthy seniors without symptoms or risk factors, routine echocardiograms are not recommended. Both the American Heart Association and the Korean Society of Cardiology advise against routine echocardiograms for asymptomatic individuals. Studies have shown that among adults over 65, the chance of finding a clinically meaningful abnormality is less than 5%, and changes to treatment are made in less than 1% of cases. Instead, the focus should be on regular blood pressure monitoring, lifestyle improvements, and preventive care, all of which are more effective and economical. Now, let's move on to the second unnecessary test. Please stay focused. It may surprise you. Brain, MRI, and MRA. Brain MRI scans reveal structural abnormalities in the brain, while MRA examines cerebral blood vessels. These scans are extremely helpful for diagnosing brain tumors, hemorrhages, strokes, or vascular anomalies, especially when symptoms such as headaches, dizziness, paralysis, or seizures are present. High-resolution imaging can detect even minute lesions, offering valuable diagnostic clarity. However, for healthy elderly individuals with no neurological symptoms, routine brain MRI and MRA scans may not be necessary. The problems with unnecessary brain imaging are several. First, the cost. These tests typically range from $500 to $1,000 and are often not covered by insurance when used for screening purposes, creating a heavy financial burden. Second, clinically insignificant abnormalities, small harmless lesions, are frequently detected, triggering unnecessary follow-up tests and fueling anxiety. Third, MRI requires patients to lie still inside a narrow tube for over 30 minutes. This can be particularly uncomfortable, both physically and psychologically, for elderly patients. Take the case of Mrs. Lee, age 76. She underwent a high-end comprehensive checkup that included brain MRI without any specific symptoms. The scan revealed an unruptured intracranial aneurysm. Though multiple specialists determined it was small and posed minimal rupture risk, the discovery plunged her into extreme anxiety. "Doctor, it's like I have a time bomb inside my head, ready to explode at any moment." Afterward, Mrs. Lee became paralyzed by fear. She stopped exercising, canceled travel plans, and eventually developed depression. At 85, I too underwent a brain MRI after experiencing brief dizziness. Thankfully, no significant issues were found. Yet even without claustrophobia, I found the experience of lying motionless inside the machine for over 30 minutes deeply uncomfortable. I can only imagine how much more distressing it must be for many elderly patients. One of my physician colleagues underwent a brain MRI as part of a routine screening and discovered a small meningioma. Although no treatment was necessary, he has since been subjected to follow-up MRIs every 6 months, along with recurring anxiety and unnecessary medical expenses. When then are these scans appropriate? They are essential when experiencing severe or worsening headaches, dizziness, sudden paralysis, speech disturbances, rapid memory loss, or cognitive decline. In patients with high risk of cerebrovascular disease, brain imaging may also be considered. For healthy elderly individuals without symptoms, routine brain MRI and MRA scans are generally not recommended. Screening intervals should be tailored to each individual's medical background and symptoms, as evidence does not clearly support the benefits of routine imaging in asymptomatic adults. The American Academy of Neurology and the Korean Neurological Society both advise against routine brain MRI or MRA scans for screening purposes. Studies have shown that incidental silent brain infarctions are found in approximately 20% of asymptomatic seniors over 65. Yet only a small fraction of these cases progress to stroke. Furthermore, unnecessary detection often leads to the use of anticoagulants, increasing the risk of bleeding. Preventing stroke relies far more on managing blood pressure, quitting smoking, adopting a healthy diet, and other lifestyle changes, measures that are both safer and more effective than brain scans. Now let's discuss the final unnecessary test: PET scan, positron emission tomography. PET scans use radioactive tracers to visualize metabolic activity within the body. Since cancer cells typically have higher glucose metabolism than normal cells, PET is highly useful for diagnosing cancer, staging disease, and monitoring treatment progress. It also aids in diagnosing degenerative brain diseases like Alzheimer's and evaluating heart muscle viability. Yet, for healthy seniors with no symptoms or known cancer risks, routine PET scans are not recommended. The downsides are clear. First, the cost. PET scans usually cost between $1,000 and $1,500, rarely covered by insurance for screening purposes, creating an enormous financial strain. Second, radiation exposure. A single PET scan delivers a radiation dose dozens of times higher than a standard chest X-ray, posing significant long-term risks, particularly for elderly patients. Third, false positives. Non-cancerous conditions like inflammation or benign growths can exhibit elevated glucose uptake, leading to misdiagnoses, unnecessary treatments, and heightened emotional distress. Mr. Kang, 73, underwent a premium full-body checkup that included PET scanning. The scan detected mild metabolic activity in his thyroid. This led to a biopsy, which thankfully revealed a benign nodule. However, for over a month, Mr. Kang lived in constant fear and insomnia. "Doctor, my heart was racing. I couldn't sleep. I was living in pure agony through that waiting period." As a physician, I approach PET scans with great caution. 30 years ago, when my hospital first acquired a PET scanner, many doctors, enthralled by the technology, recommended it broadly. Over time, however, we learned painful lessons. Among elderly patients, incidental findings often led to unnecessary tests, surgeries, and emotional suffering. I myself underwent PET scanning at 85 due to a persistent cough. Thankfully, lung cancer was ruled out, but the week-long wait for results felt like one of the longest stretches of my entire life. Experiencing this as both doctor and patient deepened my understanding of how emotionally burdensome unnecessary tests can be. When should PET scans be considered? In cases where cancer has already been diagnosed or when unexplained fever, rapid weight loss, or other serious symptoms are present. They may also be useful when other imaging tests reveal ambiguous findings or for differential diagnosis of neurodegenerative diseases. For healthy seniors with no symptoms or high cancer risk, routine PET scans for cancer screening are not recommended. Screening intervals must be individualized based on existing conditions and clinical context. The American Society of Clinical Oncology and the Korean Society of Nuclear Medicine both advise against routine PT scans for cancer screening in asymptomatic individuals. Studies show that incidental findings on whole-body PET scans translate into actual cancer diagnoses only 1% to 2% of the time, and these cancers are usually detected through other targeted screenings, such as colonoscopy, endoscopy, or mammography. One PET scan exposes the body to radiation levels roughly 70 to 100 times that of a single chest X-ray. In elderly patients, the cumulative radiation risk must be carefully weighed. For cancer prevention and early detection, organ-specific screening such as colonoscopies, endoscopies, mammograms, and lifestyle improvements remain far safer and more effective than PET scans. Today, we've journeyed through the delicate balance between necessary and unnecessary health screenings in our later years. The most important lesson I've learned through 60 years as a physician and through my own 90-year journey of aging is this: health screenings must always be personalized. Let's briefly review. The colonoscopy. Begin at age 50. If normal, repeat every 5 years. If polyps are found, every 1 to 3 years depending on their size and number. Colorectal cancer, when detected early, has a cure rate exceeding 90%, and by removing precancerous polyps, we can prevent cancer entirely. The upper endoscopy. Start at age 40, every 2 years. If you have a family history of stomach cancer or precancerous lesions like atrophic gastritis, begin earlier and consider more frequent monitoring. In Korea, where gastric cancer is tragically common, early detection offers a cure rate of over 95%. Now, the unnecessary tests, the echocardiogram. If you are healthy, without symptoms or cardiac risk factors, it is not needed. Instead, focus on managing blood pressure, diabetes, regular exercise, and maintaining a balanced diet. These have far greater impact on heart health. The brain MRI and MRA. For healthy individuals without neurological symptoms, routine brain scans offer little benefit and often introduce unnecessary fear. Stroke prevention relies much more on managing blood pressure, avoiding smoking, and living healthily. The PET scan, when performed on healthy seniors with no cancer risk, the risks from radiation, false positives, and emotional distress far outweigh any potential benefit. Cancer prevention is far better achieved through organ-specific screenings and healthy lifestyle choices. In health, more is not always better. What matters is what's appropriate for you, your age, sex, family history, current health, and lifestyle. No single test serves everyone equally. As I stand before you, a physician with 6 decades of practice and a man who has lived through 90 years of life, I can tell you this with certainty. True health in old age does not come from excessive testing or obsessive diagnoses. It comes from simple, consistent prevention, timely detection of real risks, and above all, a way of life grounded in balance. Nourishing food, restful sleep, meaningful relationships, and the quiet courage to trust your body more than your fears. Take the time to sit with your primary care doctor, have open conversations, choose only the screenings that fit your unique situation. Remember, every medical test carries not only potential benefits, but also hidden costs, emotional, physical, and financial. Health is not something preserved solely in hospital corridors. It blossoms in your kitchen, your walking path, your conversations with loved ones, and your quiet moments of rest. Now, allow me to gently ask, what has been your own experience with health screenings? Have you ever undergone a test that brought you peace, or one that left you feeling more anxious than before? Share your story in the comments. Your experience may quietly guide someone else toward a wiser path. And if you found even a small light of guidance in today's message, I invite you to subscribe, gently tap the like button, and turn on notifications so we may continue walking together through this journey toward wise, empowered aging. Before I close, there's one more important discovery I want to leave you with. In recent months, researchers have uncovered something astonishing, a natural compound hidden inside what they're calling the mysterious purple peel. Early studies suggest that this extract may support your body's ability to burn fat up to 3 times faster, even while you sleep, without the need for harsh diets or exhausting exercise routines. If you, like so many, are seeking not only to protect your health, but to reclaim control over your body, energy, and self-confidence, this quiet breakthrough may be a turning point. You'll find more about it quietly waiting for you in the video description. As always, thank you for walking this path with me. May wisdom guide your choices, and may peace accompany your years.